these are new classification criteria for large vessel vasculitis, specifically giant cell arteritis and Takayasu's arteritis, the two main forms of large vessel vasculitis. There are other forms as well. And what we've done is, rather than purely revise the 1990, we've started again from scratch, if you will, with a great number of cases from a wide variety of centers throughout the world. This was a very large international effort. I want to stress on that. This was really a great community effort in the field of rheumatology. And we have reinvestigated those elements that would allow us to classify a patient with giant cell arteritis versus Takayasu's arteritis versus another form of vasculitis, for example. And by going back, in the last 30 years, as discussed, since the 1990s were developed, there's been an adoption of much more imaging techniques in every aspect of medicine, and especially in the evaluation of possible vasculitis, with MRI, CAT scan, and ultrasound being used a great deal more, therefore allowing us to have more enriched data in which to make these decisions and these things. And so I think the new criteria, for example, really take greater consideration of not just imaging, but some of the, I don't want to say subtleties, but the details of imaging. And additionally, we're using sophisticated techniques for classifying and using a large amount of data that we have available to us. Some of the work that we and others have done have demonstrated that the more you look, the more you find in these disorders. So if you do comprehensive imaging of the aorta and its main branches throughout, you often see more lesions that certainly that are apparent clinically that you might have on your initial diagnostic interventions. We do many fewer catheter-based angiograms than we used to. That used to be the only way to really do angiography, and now we do a lot more CT and MR, and allows us to get more imaging on more patients at more time points. And as a result, we see the diseases haven't changed, I don't think, but our appreciation of the diversity of the vascular manifestations of the disease have become more apparent. And therefore, for example, the criteria that our colleagues will present it this afternoon will include sort of how they cluster together different groups of the manifestations, etc. I want to be careful to point out that classification criteria are not meant to be used as diagnosis. These are patients that physicians already feel have vasculitis. It's to sort out among the different types of vasculitis. So nonetheless, they often are, I think, inappropriately used for diagnosis. I think the better way to think about it is, can it improve awareness of these different aspects of disease and the importance they play in thinking about these diseases. And I think they will be helpful to the clinicians who may not see these diseases as often as someone like me who's at a major vasculitis center per se. And so I think it provides awareness and it provides a tool, especially for research and investigation, but that seeps out into the broader community. Our project was combined by many people, certainly not just me. I'm one of the chief investigators along with two others in the United Kingdom, and this project involved 100 centers and countries in 5 continents, and was really a major sort of community effort within rheumatology.